You're listening to the NHC Radio Network. Welcome to the Natural Health Report with Dr. Bill Thornton, licensed chiropractor and doctor of wellness. This program provides information on how to get well and stay well, how to live longer and live better with natural medicine. And now, here's Dr. Bill.
Hey, thanks, Johnny Morris. Hi, everybody. This is Dr. Bill Thornton on the radio from California to the Carolinas and around the world on the NHC Radio Network.
I am one of the many that will speak for her now. She shouldn't have had to die.
I'm angry at the fact that there's nobody there to help me. I'm angry at the fact that this disease is being ignored. I'm angry at the fact that there's a Hippocratic oath out there that these doctors are supposed to heal me, and they ignored me. And they put a price on my life which was nothing. Nobody was there to help me. And instead, they blamed it on me by saying it was all in my head.
Well, we have for you today a dramatic tale of microbes, medicine, and money. An eye-opening new film investigating the largely untold story of Lyme disease, an emerging epidemic larger than AIDS. Well, these are some of the words from the DVD liner notes of the new film Under Our Skin, which follows the stories of patients and physicians as they literally battle for their lives and their livelihoods. And this film brings into focus a disturbing picture of our healthcare system and its seeming inability to deal with a silent terror under our skin. In other words, how our healthcare system seems to be failing us and betrays us, abandons us in our hour of greatest need. The director of Under Our Skin is with us today to bring an awareness of this creeping, insidious malady. It's named for a town in Connecticut where it first appeared. It's Lyme, L-Y-M-E, Connecticut. And Lyme is not just an East Coast disease, as some people believe. We actually have it here in California. And so it's bicoastal, and it's north and south and all the points in between. And it isn't quickly cured, as some people believe. There are thousands of unresolved chronic cases in both children and adults who are in a living nightmare of physical and emotional pain, largely ignored and scorned by some of the conventional medical establishment. Today, some of the facts you need to know about Lyme disease, my friends. I think you want to hear this. Stay tuned. The doctor is in.
You're listening to the Natural Health Report with Dr. Bill Thornton, licensed chiropractor and doctor of wellness. And now, back to Dr. Bill.
My special guest today is filmmaker Andy Abrams Wilson. He's producer-director of Under Our Skin. Mr. Wilson is an Emmy-nominated producer, director, and cinematographer with a B.A. in social anthropology from Northwest University. He also holds a master's in visual anthropology from the USC School of Cinema. And he also received numerous awards for his work, and he's appeared in such venues as HBO, PBS, and the Sundance Film Festival. I'd like to take a moment now to welcome Andy Wilson to the Natural Health Report.
It's great to be here.
Now, Mr. Wilson, this is a visually stunning film. I've seen it a couple of times on a preview. But let me play the part now, if I may, of a listener who doesn't have a whole lot of information about Lyme disease. Why is there a need for a documentary on Lyme disease? Isn't this a limited disease with limited geography and limited numbers of persons affected?
Well, I asked myself that same question, why a documentary on Lyme disease? That would be the last film that I thought I would make. My only experience with Lyme disease was that my twin sister had it years ago, and I just remember she was always tired. She looked fine, but she was always tired and in pain and exhausted all the time. And I know she wasn't getting help, and I just remember her complaining a lot. So that was my only experience with Lyme disease, and I think that's what most people know about Lyme disease, or at least that's what they think they know about Lyme disease. So it wasn't until a friend of mine here got very sick, and she was diagnosed with MS and then ALS and then finally Lyme disease. So she had severe neurological and cognitive problems, some that seemed to be even life-threatening. And so when she got the diagnosis of Lyme disease, I was just shocked that Lyme disease could do that. It was not what I thought I knew about it, and it defied the assumptions that I had. And as I began to look deeper into the issue, I found what was really a shocking story untold suffering of just thousands and thousands of people with the same sort of trajectory, that they get sick, they're told that there's nothing really wrong with them, it's all in their head, and they're left to fall through the cracks of our medical system. I guess the big headlines about this disease is that chronic Lyme disease is actually a very severe and sometimes life-threatening disease, and it is likely an epidemic that's larger than AIDS, and it is hidden from public view.
Andy, you mentioned ALS. For the audience, it's amyotrophic lateral sclerosis, often referred to as Lou Gehrig's disease, for the Yankee baseball player who died of the disease many years ago. ALS is a progressive neurological disease which gradually weakens all the muscles of the body, in particular the muscles of respiration, and eventually these folks die as a result of being unable to breathe. The connection here is that Lyme disease seems to mimic or look like ALS, as well as a number of other neurological diseases, which makes it very difficult to diagnose. This difficulty of diagnosis is apparent in this clip from the movie Under Our Skin, where these patients have seen many doctors and spent many, many dollars to get a proper diagnosis of Lyme disease.
I have seen probably 30, maybe more doctors.
35 doctors.
About 15 doctors.
I've spent over $100,000 out of pocket.
$75,000
$150,000.
to $100,000.
I was misdiagnosed for 3 years.
5 years.
14 years.
15 years.
Hundreds of thousands of dollars.
I'm guessing that my case, which could have been controlled with probably a single bottle of doxycycline, at the time I was bitten, probably would have cost something like $25 or $50 total, plus the doctor visit. As it is, I'm guessing that my case is now amounted to $75,000 to $100,000.
The movie Under Our Skin, about the difficulty of diagnosing their condition known as Lyme disease. Now, Lyme disease also has something else in common with another disease called syphilis. Syphilis is known as the great imitator, and as we're talking about now, Lyme disease also does a lot of imitation too, looking like many different diseases. And the similarities don't stop there. Even though Lyme disease is acquired by the bite of a tick, in other words, a tick bites a person, feeds on their blood, in the process of which the tick transfers a bacteria which is inside its body, the Lyme bacteria. This Lyme bacteria is a spirochete. Its shape looks like a corkscrew. It's the same shape as the syphilis bacteria. In the movie Under Our Skin, Dr. Alan MacDonald, a physician researcher, has made a discovery which is quite startling. The similarities between Lyme and syphilis don't end with the shape of its bacteria. Patients with chronic Lyme disease often demonstrate the same symptoms, or similar, to those with syphilis. And Dr. MacDonald also theorizes that perhaps, and it's still under investigation and has not been determined, but perhaps Lyme disease may also be sexually transmitted.
Dr. MacDonald is not the only one who has posited the relationship between the Lyme microorganism, which is called the spirochete, and the syphilis organism. They're both spirochetes, they're related organisms, and they have a sort of similar trajectory in the body. People who know about syphilis know that it had different manifestations in the body, in the skin, different organs, in the joints, in the brain, and the late-stage syphilis was called general paresis. And Dr. MacDonald is basically saying that general paresis and Alzheimer's are almost carbon copies, that the diseases are exactly the same. And what he's postulated is the possibility that what we know of as Alzheimer's, which we don't know what the cause of Alzheimer's is possibly related to Lyme disease. Just like tertiary or central nervous system syphilis caused general paresis, possibly Lyme disease, gone unchecked after years and years, could end up causing or triggering Alzheimer's.
We'll take a break here, and when we come back, we'll look at the emotional aspects of Lyme disease. For me, Andy, one of the most compelling parts of this film, which is a thread through the entire film, is the emotional impact of this disease, the way it really just takes over a person's life with the pain and disability, straining relationships. And it's made all the more devastating because the medical profession does not recognize chronic Lyme disease.